Let me tell you something that surprises a lot of nursing students. Most medication errors on the NCLEX and in real life are not rare drugs you've never heard of. They're common medications that become dangerous, let's say, when nurses miss one key safety cue. And these are called high alert medications. And today I'm going to show you exactly how NCLEX expects you to recognize them and protect your patient. And if you master this, you will instantly answer pharmacology questions with more confidence. And that's what you need. So, what are high alert medications? High alert medications are drugs that carry a high risk of serious harm or death if used incorrectly. They're not dangerous because they're bad drugs. They're dangerous because small mistakes have big consequences. That means it's the wrong dose, the wrong timing, the wrong patient, a missed vital sign, missed lab value, which can lead to a rapid patient deterioration. So the NCLEX loves high alert medications because they test whether you think like a safe nurse. So this is what the NCLEX is not asking you. They're not asking you what drug class is it. They're not asking you what chapter did this come from. What the NCLEX is asking you is it safe to give this medication right now? What assessment must be done before giving it? What finding would make you hold the medication? What adverse effect would require immediate attention? So if you approach high alert medications in this way, the answers become obvious. I want you to stop memorizing long drug lists and instead think of in groups. Okay. So, like group one, group one is insulin, very important. It's important because there's a high risk of hypoglycemia and it can cause seizures, coma, and even death. So, before you give insulin, you need to make sure and verify the blood glucose, the timing with the meal, and the correct insulin type. Because what students fail to realize is that if on a question, they'll give the insulin without checking the blood sugar first. And that's one thing that we typically do with our students. We'll say that, we'll have all of this information. And the big thing is that they tend to say, oh, well, the patient's confused and the patient is this and they have all these problems. And then they just give the medicine, they give the insulin without, and the answer is check the blood sugar. Simple as that. Okay, so don't get tripped up on that one. Number two, anticoagulants. Examples: heparin, warfarin, enoxaparin. They're important because there's a risk for internal bleeding on your patient, hemorrhage, or stroke if mismanaged. So you're going to always check the INR. You're going to always check the PTT. One thing to think of: two T's, PTT put together makes an H, and that's always for heparin. Okay. And then you're going to be looking for signs of bleeding. Now, one thing that trips students up, they ignore bleeding signs or lab values. Now, for our opioids, examples of those are morphine, hydromorphone, fentanyl. The risk is respiratory depression, decreased level of consciousness, and hypotension. So, as nurses, we're always going to assess respiratory rate, oxygen saturation, and level of consciousness. Remember, if the respiratory rate is less than 12, do not give the opioid. Okay? Don't give the pain medicine, regardless, because the family is going to be yelling at you and, oh, they're in pain, but their respiratory rate is already low. Do not give the medicine if the respiratory rate is less than 12. Okay? Let's see, let's move on. Cardiac medications. So examples are digoxin, beta blockers, calcium channel blockers. The risks for those medicines are bradycardia, heart block, and cardiac arrest. So as nurses, we're going to always assess heart rate, apical pulse, potassium level, especially for digoxin. The biggest thing with the cardiac medicines is you don't want to give them if the heart rate is less than 60, and that usually trips people up. They may give a high blood pressure and a low heart rate, and the student will pick to give the medicine because they're focused on the blood pressure, not realizing that they need to be focused on the heart rate with these medications. Group 5, electrolytes, especially potassium. Potassium is never something that you should ignore. Risks are dysrhythmias and cardiac arrest. Rules: please never push IV potassium. You will kill your patient. Hold potassium if it's high. Check renal function. A red flag and an NCLEX trap would be the patient has potassium abnormalities and then they have cardiac medicines. And so you can't give the cardiac medicines if there's a potassium abnormality, especially if it's high. Okay. Let's see. Pause and protect safety rules. So one thing that you're going to have to remember is that before giving any high alert medication, you need to pause and ask yourself 3 questions. What is the most dangerous side effect of this medication? What assessment or lab value you would warn you to not give the drug? And what could happen if I give it anyway? So if you can answer those 3 questions, you will not miss a high alert medication question. All right, let's do some quick little scenarios. You have a patient's blood glucose 62. They have an order for insulin. What's the safest action? Hold the insulin and treat the hypoglycemia. Scenario 2, patient has a respiratory rate of 10. They have morphine IV ordered. Don't give it. You need to assess the respiratory status first. Scenario 3, patient's INR is 4.6 and they have warfarin ordered. Hold it. You're going to put your patient at risk of bleeding because the INR is too high. Scenario 4, heart rate 52. Metoprolol is ordered. You're going to hold it because the patient is already in bradycardia, and that's a dangerous cue. So it should tell you, okay, it's less than 60, hold the metoprolol. Like I said before, you can always hold something, but if you give it, you can't take it back. And so why would you ask yourself these questions? And think through this, because students miss these types of questions because they focus on the medication name. They may ignore the vital signs. They may skip over the labs. They forget safety thresholds, and then they may panic under pressure. But once you kind of see the pattern, it becomes predictable. That's why in clinical, we always say to look at labs, assess your patient, look at trends, because it will give you the information that you need when giving a medication. Okay? And so, hey, that's it. Remember, high alert medications are not about memorization. They are about patient protection. So download the Pharmacology Safety Workbook at NurseEdScholar.com. I'm working on it, so just keep checking it, and I'll have, ways for you to practice high alert medication scenarios with rationales. And please subscribe so you don't miss lesson 3, look-alike and sound-alike medications, those NCLEX traps. And remember, study smarter so you can test like a pro. Thank you for watching Nurse Ed Scholar. I'll see you soon.